22 minutes before 7, founded in 2009, the African Leaders Malaria Alliance is a groundbreaking coalition of 49 African heads of state and government working across the country and regional borders to achieve a malaria-free Africa by 2030. This week, African leaders are meeting in Kigali, Rwanda, to adopt a comprehensive new roadmap to eliminate malaria in Africa by that year, 2030. So joining us in studio to tell us a little bit more, we've got Sherwin Charles, Alma's spokesperson. Good to see you again. Welcome to Morning Live.
Thanks, Leanne.
All right, the last time we spoke, well, I think you spoke to Palesa, you were again focusing in on issues of malaria. But this is a big week. It really is a big week with a meeting taking place in Kigali. But my question to you is, eliminate malaria in Africa by 2030. Is this not sort of a very bold goal to achieve?
It is a very bold goal for Africa to achieve. I think the great thing about the initiative now and the catalytic framework that is being put forward at the AU Summit is that for the first time it is truly African-owned and African-led. And they've put together a roadmap with clear milestones and targets for us to achieve it.
Yeah.
It's still a massive, massive goal.
What are some of these milestones? What needs to be put in place to get to this position?
So I think the biggest issue for them is ensuring that we can maintain the universal coverage that we've achieved so far in Africa. That means we need resources, both funding as well as human resources to achieve this target. So as part of the milestones, the first objective is to get 6 countries to eliminate malaria by 2020. Now, why is that important for us as South Africa? Is we're one of them.
Yeah.
So South Africa, Botswana and Swaziland are the 3 Southern African countries that are aiming to eliminate by 2020. The target is 6, the other 3 countries being Cape Verde, Comores and Algeria.
That's 4 years' time. I just want to focus on South Africa. In 4 years' time, and if you look at a map of where there are malaria-infected areas here in South Africa, it's still a lot, and we still have a high death rate from malaria. So how do we speed this up and to achieve that?
I think South Africa has got close on to 12,000 cases of malaria a year.
Yeah.
We know the areas that are the hotspots. Now, we as Goodbye Malaria, for example, we work in Mozambique. We're part of Masaswa, which is a regional initiative to ensure Swaziland and South Africa get over the line. We deal with southern Mozambique, where there's a lot of imported cases coming into Swaziland and South Africa. And South Africa has the capacity to do it. So what we need to do, though, in South Africa is to strengthen some of our local institutions in terms of research, in terms of surveillance. Somebody like the MRC, the Medical Research Council, or the NICD. Those are important institutions that will help us get over the line. The resources are here. We need to increase domestic funding. That's why for us as a corporate getting involved in malaria, it's so important.
Yeah.
We need to get other corporates to join us in the fight. But it's certainly a target that is fully achievable.
Yeah. Who has done this? If we look at a country or an area that has been exceptionally successful in eliminating malaria, whose example can we follow?
There have been countries that have been very successful. Mauritius, as one of our African countries, has done a great job. You've seen it happening in across the continent. In fact, malaria deaths across the continent are probably down 75%.
Oh.
So we have made great progress. The challenge is to sustain that progress.
Yeah, yeah.
The biggest risk is funding. And if you look at this framework, one of the challenges listed in the framework is funding. We need our leadership, our heads of state, to increase domestic funding towards malaria. This framework covers AIDS, TB and malaria, but for us malaria is the important part of it, and part of that is to say to our leadership is to look at the Abuja Declaration, look at increasing health budgets, and ensure that we meet the targets that we've set ourselves.
Yeah, you almost feel it needs to stand alone as a fight malaria and a fight TB, not to sort of get them together, because I mean each one of them come with their own issues. So it's something that should be targeted alone. When we talk about eliminate, what are we talking about? Are we saying that, just for an example, that once it's been eliminated, we can go anywhere in the country, people that live in that area, there is no risk at all that they will contract malaria? Or do we still need to take precautions?
I think if we've said we've eliminated malaria, which then leads on to eradication, means the country's malaria free and there's no local transmission of malaria. Local transmission means from one local to the next, mosquito biting someone in country who's not come in with malaria from traveling, so having local transmission. I think the important thing though is that you would still be at risk in terms of malaria. So Johannesburg is a massive African hub. We have lots of travel coming through Johannesburg, so someone could come through the country with the disease already, so they carrying the parasite on them. But however, if you have surveillance methods and you have rapid response teams that deal with these cases on an individual basis, then you can contain it. So as long as there's no local transmission, you've eliminated malaria.
Yeah. In terms of the work that ALMA is doing, what exactly do you guys do when it comes to the eradication of malaria?
Well, ALMA has created a scorecard, and I sit as the chairperson of the ALMA selection committee. So we're responsible for the awards that ALMA hands out to the heads of state. But from an ALMA perspective, they created a scorecard, and I must tell you, having been at the ALMA meetings at the AU Summit, it's amazing how seriously our heads of state take the scorecard. You see them looking at each other's scorecards and comparing, are you red or are you green? And so the scorecard is a very quick way for the heads of state to see how they're progressing on the various issues regarding malaria. It was a scorecard generally around policies and implementations of control. ALMA have now released a elimination scorecard that shows the heads of state from in-country data how they're achieving their targets towards elimination.
Fantastic. Well, listen, we wish you the best of luck. Will you be going at all to
Kigali? I'm not. Sadly not. But I believe it is a very important summit this weekend. There's obviously a change of leadership, so they're expecting the vote probably to take place. Nkosazana Zuma was not standing for the election. So I think it is an important weekend in Rwanda.
It certainly is. It really is a big one. We'll be watching with much keen interest here in South Africa to see whether or not she actually does stay on for the next few months. But that's another conversation altogether. Sharon, thanks for coming in once again. Sharon Charles is a spokesperson for African Leaders Malaria Alliance. The aim is to eliminate malaria in Africa by 2030. Those little mosquitoes causing lots and lots of problems. We didn't even touch on the Zika virus, so that's something else. But our focus here is malaria. All right, let's take a break. We've got more after this. We're heading up to 7 o'clock on this program. Stay tuned.